It evolved during a chat with a friend where we were discussing about the fractured healthcare in the country and how big segment of the population, the middle income families, don't have a great choice in terms of healthcare options. We did a lot of research over a period of 1 year, visited a number of hospitals who particularly take care of large volume of patients in this income group. Understood the issues, and that led to evolving the DIHA model of healthcare. I used to run businesses, but in healthcare, I had no great interest to start a for-profit. It was more serving the community and how we can make a difference in a community, particularly a suburban community. That was more exciting. The first and foremost is for the middle income families, they need a viable, attractive option, where particularly when the elders in the family fall sick, the youngsters who are in the middle income range shouldn't have a worry about where to take them. They can bring them to DIHA and get a very high quality care without worrying about very high costs of care. I think that was the primary motivation, to really help the middle income families. There are 4 key USPs for DIHA. Number 1 is that they get very high quality care comparable to corporate hospitals, be it in terms of infrastructure, so the quality of staff, the experience of the doctors we have, they should get very high quality care. That is number 1. Number 2 is what we call as honest care, that a patient will be able to come here confidently, knowing that only those tests that are absolutely required to assess the condition of the patient will be prescribed, will be carried out. And number 3 is we value the patient's time. We don't want them to wait for a long time here. So with the good scheduling of appointments as well as other facilities we have created, we want to make sure the wait time is as low as possible. In fact, most of the case, the patients don't wait more than 10-15 minutes to see the doctor. I think that's equally important for us because everybody's time is pressed today. Quality of time the doctors spend with the patients. Our doctors are not rushed. They will spend time to address not only the medical question that the patient has, but also help them psychologically to deal with the situation that they are currently facing. And I can tell you a number of patients who visited us have really talked about it and how it has been of great value to them. Gives them peace of mind. And of course, basic hygiene things like a very clean hospital, very comfortable environment. Many people say that DIHA doesn't feel like a clinic. I think that's the kind of atmosphere that we want to keep here and take care of the people. While we provide such high quality care, we want to make sure that it doesn't cost a lot of money for the patients. The fact that we only do absolutely necessary tests and we prescribe medications only to the extent that's actually required for the patient ensures that the total cost of care for the patient is far less. When we did the research across multiple hospitals, we understood that out of 100 people who walk into a hospital, which has both inpatient as outpatient facility, 95% of them want only outpatient care. So we decided to focus on outpatient care. But again, in outpatient care, diagnostics is a very important part. It should be available so that the patient, once they walk in, see the doctor, and then if any tests are to be done, they can get it done in the same place and then see the doctor again with the result. That's why we invested a substantial sum in creating all the basic diagnostic facilities within DIHA. Well, I've been focused on how we can deliver high quality service to our customers and also create a quality environment for our own employees to work in the organization. So I would say it's in my DNA to create quality organization, and NABL was a very nice goal to have. See, when you have an external accreditation goal, it drives the organization and all its members to work towards it. In the process, quality becomes a way of life within the organization. That was the motivation. And glad to say that in the first year that we applied, we got the NABL certification. Well, I would say the immediate term mission is to be the clinic of choice for people in Nanganallur. I hope all Nanganallurian, if I can call them so, will buy into it and will make Diha their own clinic. Our appeal is come try Diha once. I think the experience you will get here is unique and very different too. It will give you a great peace of mind that in future you don't have to go anywhere else to take care of your healthcare needs. So come try us once. To existing customers, first of all, thank you for being part of the Diha team and making it what it is today. I think your encouragement, not only by coming here for treatment, but also the very high price that you have shared with us in social media as well as in person. It really motivates us, and keep doing that. And number two is spread the good word around and in your neighborhoods amongst your friends so that more people can benefit from Diha. Thank you for being part of the Diha family.